Welcome to the Conservative Line, ladies and gentlemen. My name is Anthony, and I'll be your host for today's show. Today's discussion will be universal health care. The Obama administration and the Democratic-controlled Congress are campaigning on an ambitious program to nationalize our health care system. Let us be clear that most Americans are indeed happy and content with their health insurance coverage, including myself. In fact, the United States has the best healthcare system on the face of the earth. Whenever we are faced with a medical issue, we currently have the freedom and flexibility to choose the best physicians, the best surgeons, and the best medical exams. Best of all, we as Americans do not have to wait months or years for treatment. This could potentially be the difference between life and death. This is the magnificence of our healthcare system, ladies and gentlemen. Yet, the Obama administration ambitiously desires to introduce European socialized medicine. Obama himself has been quoted to emulate the Europeans. This is foreign to our nation, foreign to our founding, and foreign to our society. In Europe and in Canada, socialized medicine has been an utter failure, particularly with our friends in Great Britain. There is incontrovertible evidence that patients have to wait months to schedule physician appointments. And once diagnoses have been established, it may take years to treat. In fact, one may never receive treatment at all for deadly diseases, such as cancer and heart disease, two leading causes of death. Statistics show that cancer survival rates are significantly lower in Europe, particularly in France and Great Britain, when you compare those countries with the United States. The government of Great Britain will even deny treatment to substance abusers. Recently, a 22-year-old man was denied treatment for liver cancer because he was an alcoholic. Routine medical examinations, in other words, preventative medicine, such as mammograms and colonoscopies, are simply not readily available in those countries. And the reason for socialized medicine's utter failure? The government, ladies and gentlemen. The government is placed between physician and patient. That physician-patient relationship has long been held to be a sacrosanct relationship. And now, a young, inexperienced government bureaucrat, an ordinary citizen like you and I, will now stand in the way of critical life and death decisions. Think about that, my fellow Americans. Let us now examine some key aspects of President Obama's healthcare initiative. Number one, a choice between government and a private option. The president is lying about choice. His goal is to phase out the private option. In fact, as an example, as soon as there is a change to an existing private policy, such as a change in deductible or copay, the patient will automatically have to enroll in the government option. Ladies and gentlemen, read the HR bill. It is available on the internet. And number two, the 45 million uninsured figure. According to the Obama administration, there are 45 million plus Americans without health care. This, my fellow Americans, is another downright lie. Mr. Obama, why do you seek to deceive the American people? Do you not have any shred of integrity? Let us deconstruct the 45 million figure. First of all, that 45 million figure includes 10 to 15 million illegal aliens that are currently residing in the United States. Yet Mr. Obama continues to cite that the 45 million figure consists of American citizens. Simply not true. Next, there are millions of Americans that range between the ages of 18 and 35 that for whatever reason choose not to participate in any health care coverage. So, if we deduct the illegal number and the folks who choose not to elect health care coverage, the actual number of uninsured is significantly lower, closer to about 15 million people. does it make sense, Mr. Obama and members of Congress, to destroy the insurance plans of hundreds of millions of people for the sake of 15 million? And number 3, universal health care will cost trillions of dollars. It is predicted that cost will continuously balloon over the years. Look at Medicare and Medicaid. These programs are broke, ladies and gentlemen. Is there any entitlement program that has been on budget? The answer is no. Why does President Obama think his program is any different? Even more interesting is that President Obama continues to ignore the warnings from the Congressional Budget Office, or CBO, that healthcare costs will spiral out of control. Keep in mind, ladies and gentlemen, that the CBO is a nonpartisan group. 4. The brains behind the healthcare push is Ezekiel Emanuel. He is the brother of Rahm Emanuel, the current White House Chief of Staff. A medical doctor himself, Mr. Emanuel has long been known to be a radical proponent of socialized medicine. In fact, Mr. Emanuel is a strong proponent of age discrimination. He was quoted as saying no to senior coverage, and that age discrimination is not evil like racial discrimination. His rationale is that, well, being 65 years old, you were once 25, gives someone else the opportunity to experience life. Seniors with incurable diseases, such as dementia or terminal cancers, should not be covered. Yet AARP endorsed the Obama healthcare plans. Would you want the government, ladies and gentlemen, to deny coverage to your mom, to your dad, to your grandparents? Think about what I just said. The government will deny coverage to seniors who need healthcare coverage the most. This is madness. We used to call the seniors as the golden years. Today, under the Obama government, the senior years are now referred to as the end of life period. Shameful you are, Mr. Obama. Number 5, rationing. Obama claims that his program will cut costs. Yes, but by cutting services. In other words, a system of rationing, just as they do in Europe and how it was practiced in the former Soviet Union. This is antithetical to the free market. Let the private sector allocate the resources. 6, funding. The program will be funded primarily through massive taxation and by printing money and by a systematic reduction of Medicare benefits. This is one of the reasons why the Democratic Congress is looking to pass cap and trade, which is nothing more than a funding vehicle to fund universal health care. Insurance to illegals. The bill seeks to provide insurance to illegals. This will in fact encourage additional migration of illegals into the United States that will further A, ration healthcare services, B, lower the quality of healthcare, and C, increase the cost of healthcare that will increase the budget deficit. In closing, the majority of insured are satisfied with their insurance. Ladies and gentlemen, our great nation has in place a system of healthcare that is the envy of the world. We're at the cutting edge when it comes to medical equipment and pharmaceuticals, and our colleges and universities produce the finest physicians. Now pause for a moment and think about why this is so. The answer is liberty and a free society. Ladies and gentlemen, I urge you to contact your congressmen and your senators to voice your opinion and your opposition to universal health care. Vote no. Thank you and good evening. And may God bless the United States of America.